I'm Dr. Sarah Kale. I'm a physical therapist here at Wave Physical Therapy and Pilates. Today I'm here to talk to you a little bit about working on breathing exercises with a balloon. There are a few reasons that we might want to do this. One of the main reasons that I do this is to help with actually finding some resistance in our breathing. So I help my patients work on learning how to breathe properly, finding that nice 360 breath, breathing deep into the diaphragm, and helping that recoil, and also finding that nice active exhale on a core for core engagement. So that's what we're going to do with the balloon, is find that nice active exhale and the ability to contract the abdominal muscles evenly through that exhale. It can be a great exercise for people who have pelvic floor dysfunction as well, to learn how to get the pelvic floor on board. However, we always want to make sure that we kind of train the basics first. So this is more of an intermediate to advanced exercise for those. So I would recommend that if you aren't sure what I'm talking about as far as the 360 breathing or the active exhale, that you work on that first, or that you find someone to help you with that. So we're going to try to load this. This can also be a lot of pressure down on the pelvic floor if you're not doing it properly. So definitely don't do it if you have prolapse until you have a professional help you with it. So when we do, I'm going to lay down. Oftentimes we'll start this in supine or laying on your back. So lay down. So first thing first, we'll just start with a nice deep breath and make sure that we can take that breath in 360 degrees. The rib cage fills up. And then as you exhale, the air flows out. With that active exhale, we're going to take that 360 breath in. The rib cage expands. Then as we breathe out, we're going to contract the abdominals evenly. Kind of, usually I will say bottom up, since we tend to engage so much through the top first. But again, it depends on the person. So this can be a great assessment tool as well. If you feel like someone's breathing looks okay, but then maybe they go to run or something and they're not quite feeling it, adding a balloon can give you that resistance that you need to stress the system a little bit. So we'll give this a try. Take that nice big inhale. So when you take that exhale out, maybe notice a few things. That time I think I might have like arched my back a little bit to help me with that. So that might be something for me to work on. Checking in, maybe seeing if you are leaking, or if you notice an extra contraction up top and not an even contraction. So let me try that again, maybe see if I can get that a little bit better. Take a nice deep breath in. A little bit better. So try it out. Let me know what you feel, what you think, and comment, and like this post and follow us on Wave Physical Therapy.